Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
Hey everybody, this is Shelby Blankenship here with Modern Management of the Older Adult podcast. I am one of your TAs and a fellow physical therapist, and today we're going to be talking about how you can upgrade your subjective exam for evals or even just throughout your plans of care, even if you're an assistant. So what we're going to be talking about first off is with the subjective reporting, we're really trying to dive into what the patient or client is feeling from their point of view. So it's a lot of like self-reporting. So sometimes we do, some like actual filling out of the forms, like intake forms. You might have some items that are filled in there. But really we're trying to get into what are their symptoms, what are their pain levels, what functional capacity did they have, what they currently have, and that way we can get some better insight on how we can bridge the gap. Now, I know a lot of you might have taken like the lumbar course or especially like any of our spine courses, and they really dive into, finding asterisk signs and really making sure you have something that you can measure each time that patient comes in to see, are we making any changes in the good or bad so that we can change course when appropriate. Because we definitely don't want people coming in inappropriately and not having an idea of what's going on with them. But one thing that I think, especially for older adults, things can get a little bit muddy, especially when they've got lots of diagnoses that we're kind of trying to work with and multiple comorbidities. So one area for the subjective report that I really have started diving in and has really kind of helped me get a better holistic approach of what's going on with the patients is using that MEDS format. So if you're not familiar with MEDS, it's M is for mindfulness, E is for exercise, D is for diet, and then S is for sleep. So when it comes to M for mindfulness, I want to know when they are currently having any stress. Maybe that's due to the injury or diagnosis that they're coming in for, or maybe it's, related to their kids or grandkids or just any type of stressful event. What is it? How do they react to it? And how do they get it to where maybe that stress is more manageable? Because if they don't have any strategies to manage stress, we know that they're probably going to be more likely to have an inflamed system, whether that is arthritis, type 2 diabetes, etc. We want to see, are there ways that they're currently coping that are helpful, or are they currently coping not helpful? Sometimes, alcohol can kind of pop in there, and there's lots of different things. So when it comes to mindfulness, we are just trying to see, how do they manage stress? And then, depending on how that goes, we might kind of start steering them into more optimal ways to manage their stress, or at least give them some awareness that if they don't manage their stress, that can be a big component into what their current pain level is. I've seen that even with some of my patients. They tend to have flare-ups when either previous traumatic things have happened in their life. For example, like when a parent has passed away, or even a spouse, or maybe, unfortunately, maybe like a kid or grandkid, and their shoulder flares up every time this time of year. Or maybe it's during holidays where, that Christmas, every year they just get really, really stressed out. And it kind of reminds them of previous Christmases and people that should be there that aren't there, et cetera, et cetera. And so that kind of aspect is really important, because then we can maybe teach them about box breathing, or maybe we can teach them some alternatives that can help really start to kind of calm down that stress. Obviously, there's many apps out there like Headspace and Calm app, if that's something that they're into. But really what we're trying to see is, where is their baseline for mindfulness? The next one we'll go into is exercise. Now, we of course want to see like what their baseline of exercise is. Like, are they coming, doing it 3 times a week? Are they doing nothing? Are they, going for walks maybe a couple times a week? And for how long? Especially if that has any variation in when they're flared up versus not. But we also want to see with exercise, what is a normal or comfortable intensity that they're used to? So there might be some that come in that are going to a CrossFit gym. There might be some that have not gotten out the couch. So we're going to kind of see what is the tolerance for activity that they currently have, because that's going to play a huge part in how much we're going to do on our objective exam, but also how much we're going to do for our treatment and hopefully for their home exercise program. If somebody is super sedentary, I'm not going to be giving them a 15-minute AMRAP for their HEP. I want to make sure maybe it's 4 or 5 minute AMRAP, if that, or maybe we're just starting really low with just movement snacks throughout the day. Another thing with exercise that I really want to dive into is what equipment do they already have access to? This could be at home. This could also be maybe they're a member of a gym, the Y, a Stronger Life, a Stave Off, any of those kinds of things. We want to know what they already have access to and try to push them to do their home exercise program, if at all possible, in those areas to continue to promote them going to the gym. We don't want to take people out of the gym if they already have a good relationship there, or if anything, maybe we start stirring them where they're like, hey, maybe on initial eval, we do some things at home with items that they already have. And then as they get more and more confident, maybe we start leveling up. We're like, well, might be a good time to, join that Crunch Fitness or that Planet Fitness where it's, $15 a week or not a week, I'm sorry, a month. And then we can use items that they have there. So we, again, are trying to get that home exercise program where they're going into the gym. We're creating that routine so that when we discharge, it's not this lag of going never to the gym and then to the gym, and they don't get lost in translation. Then we come to our third one, which is D for diet. Now, when I do diet, I look at both from a nutrition aspect and a hydration aspect. So I will ask, what are you eating for breakfast? And they're going to name it all out, and I write it all down. And then I say, what do you eat for lunch? And they name it all out, write it all down. Same for dinner, same for snacks. I want to see how much are they eating, how often are they eating, and it will shock you, or maybe it won't shock you. Most of these people that come in, they're maybe eating twice a day, and they are almost never getting enough protein. And that's where it opens up this huge door of trying to talk to me like, hey, I noticed that you tend to skip breakfast. What are some ways that we can maybe start getting you to eat more so that you will have enough fuel to get your body healthy again, so that we can fight this pain or diagnoses or whatever it is that we're kind of combating? Because ultimately, healthy tissues are attached to healthy bodies. And when there is not a healthy body, there are ways that we can optimize that through nutrition. And that's a really relatively low hanging fruit. I know sometimes there's certain people who are absolutely adamant about not changing anything in their diet. But even if we took a one small step of hey, instead of eating, fried chicken tenders, what if 3 times a week we got the grilled chicken tenders, or, things like that. And honestly, so much of it is trying to kind of play the evil game a little bit, where you're I don't want it to be this thing where they're having to be overwhelmed with their diet. But I also want to see is there things that we can optimize that are really, really small hanging fruit? And then we kind of just slowly try to optimize that, even when it might not seem like a lot that first week. I also have created resources at our clinic to where people can order meals, especially if I have some folks that live independently, or they don't have a spouse, or they might be a little bit too busy with kids or grandkids where they don't have access to making meals all the time, or it stresses them out. And having those really good meals, so for here we have ones like Paleo Works, we have 2 Baskets of Figs, and they will actually deliver either to them or to our gym or a local gym, so they can just pick up their meals every week, and then they can order whatever they want. And it helps, especially because I already do that when they come in and I'm eating it. They're like, oh, that smells great, or, whatever. So, having those options available for your folks who, especially after a total knee, when nobody wants to cook, and if they do cook, it's always that lasagna, or it's something that's probably not the best for them. Having those options to be hey, I know this is going to be a little difficult for you, to manage cooking meals and these kinds of things. Here are some great resources that you can know they're going to get that protein in. It's going to be healthy foods. It's going to limit that extra inflammation that we'd already kind of chatted about in the mindfulness area. Now for hydration, we'll do the same thing. Usually some of my folks come in with water bottles and I'm like, hey, like how much of that do you drink a day? Or if not, if they're really adamant about not drinking water, that might be an opportunity to just kind of educate about the importance of water and how it is encompassing so much of our body, and really diving into electrolytes. We have a lot of folks here that really struggle with cramping, and Element is one that we provide at our office, and we always have sample packs available if people want to try them. But it's also important, like when folks are always complaining of like headaches or just like chronic fatigue, or they're just not drinking enough, like that is like super, super helpful to kind of help speed that along. But also like, especially in these colder months, people tend to drink less because they're like, oh, I'm not sweating, so everything's fine. But those are the times that people tend to be the most dehydrated. So really kind of diving into that. You can also kind of teach them the turgor test that you do on your skin. It's not like the best, but it can be super helpful when it comes to that. Now, let's go into our last one, S, which is sleep. Now, there's lots of great resources out there about like sleep hygiene and how there's tons of books and, you know, why we sleep and all that kind of thing. Highly recommend checking those out so you're educated on how you can optimize your own sleep, but definitely even making like a little handout for your area so that most of our folks that come in, when they have chronic pain especially, they're not sleeping super hot. And especially some of my females with being postmenopausal, or maybe they're going through menopause, like that's an area that can really be optimized to really help these folks kind of make sure that their stress level is not being impacted because of lack of sleep. So we want to make sure that they're getting, you know, that 7 to 9 hours, quality sleep. We want to check if they are getting up at night, how often they're getting up at night. Is it because they're going to the bathroom? Is it because of pain? Any of those kinds of things we can optimize, especially with the bathroom. I always advise, you know, try to limit water intake 2 hours before bed. It's amazing what that can do for a lot of these folks. But there is a really nice little handout where it has like a checklist of things you can optimize for your sleep routine. So maybe starting about an hour or 2 hours before bed, you know, turning down the lights, maybe taking a hot shower, limiting screen time, whether it's TV or phone, creating that like maybe mindfulness practice that can kind of calm down their brain a little bit. I know a lot of people kind of forget, but like nobody wants to wake up in the morning with like a gong and then immediately having to go straight to work. And it's the same thing when we go to sleep. We want this ramp up and a ramp down time. We're not expecting to watch the 10 o'clock news or somebody else got, you know, who knows what's going on out in the world, that, and then try to go to sleep. That usually doesn't work super hot for most of people, but especially our older adults who might have a harder time kind of ramping that nervous system and that brain down before they go to bed, because that will ultimately help kind of making sure that they're in a good headspace to stay asleep throughout the night. And then hopefully that encompasses their body, creating this nice holistic and really nice ecosystem to make sure that it's nice and robust to fight off things like comorbidities, as well as the pain or whatever diagnosis they're coming in with. So just a quick recap. For our subjective reporting, you know, we're always kind of looking at, you know, the asterisk signs and making sure that the self-report of what their experience perspectives with their pain, with their functional limitations, any other symptoms that they might be experiencing. But we really want to touch on that meds concept. So mindfulness or stress management, exercise, diet, and sleep. All of those will show really good opportunities to kind of up the ante on creating a robust human, so that ultimately that your treatment sessions can be optimized in the long run, and hopefully in, you know, once they're discharged, they will keep up with these habits. As far as the older adult division, we have L1 will be starting again March 17th. L2 will be May 15th, and then we've got a couple lives coming up. The March 15th and 16th will be in Sparks, Glencoe, Maryland. The 22nd and 23rd of March will be in Lamont, Illinois. And then April 5th will be in Longmont, Colorado. Hope you guys have a great Monday and appreciate y'all.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.